Hello, we are here to introduce you to the Cancer Prevention Program. My name is Dr. Dos Santos from Loma University School of Public Health. I am an assistant professor in the program of preventive care. In the cancer prevention, we have done a lot of seminars, and then I started these seminars in 2009. It was a request from the North American Division to prepare a cancer prevention for the summit. So I went to Orlando and I presented there for several times. I have done the seminar in Brazil, Antigua, Barbados, and the Republic and Dominican Republic. The Cancer Prevention Seminar, you could use that just presenting the slides or just presenting the video, but we will also provide the PowerPoint presentations, so if someone wants to present and not have the videos, also is going to be available. The purpose of the course is to present the main risk factors for different cancers, then motivated people to follow anti-cancer lifestyles, promote cancer screenings, and promote anti-cancer lifestyles to cancer patients, to cancer survivors, and high-risk individuals. In fact, this is to prevent cancer. Today we know that every single family in the United States and in the world has a relative or a neighbor that have cancer. So the disease is being very common. It is considered the second cause of death in the world after heart disease. So it's necessary to have, it's mandatory, I would say, to have a program, a community program that would be spread the prevention of the disease and the many factors that a person can do to avoid, or if a person already have the cancer, what can he or she do in terms of lifestyle to help on the treatment, to help on the progression, and to try to stop the process of cancer. The course is based on this book that we call the Cancer Bible. And this book is produced by the World Cancer Research Fund and also by the American Institute of Cancer Research. You can go to our website and put these names there, and we will provide the references in these slides, in the next slide. But this is considered the Bible of cancer. This was a study. This book is very thick, and it was a study done, a research done for several cancer specialists around the world that worked together to provide what are the best things that we could do and that people can do to prevent cancer according to the research that has been done around the world. So here you have the reference for the book, and also they are expecting to release a new book in 2017. And then you can go to those websites that are in the screening. Also, we have other books that we talk essentially about smoking and cancer. You have in the screen the Tobacco and Public Health, and also the Tobacco Atlas. The Tobacco Atlas is the one that has a lot of information about cancer around or across the world. So if you want information about your own country. Also, we have several other websites that you can check. These will be provided for you in the PowerPoint presentations in the handouts. So what is the problem with cancer in the world? We have in 2012 14 million new cases of cancer. And then it is expected to rise by 70% in the next 2 decades. Probably will be the first cause of death. In 2015, it was the second leading cause of death in the world by killing, I would say, 8.8 million people across the world. One of the 6 deaths in the world is due to cancer. 70% of deaths are in countries that are middle and low income. So we have a disease that is related to lifestyle, that is considered a chronic disease, and at certain point is a disease of the rich countries. But now this disease is reaching, is, I would say, attacking the countries that are not very well developed, that are in development, and then bringing a burden of disease for places that don't have the resource to deal with them. 20% of the deaths related to cancer are related to smoking. Then we have virus. 25% of deaths in middle or low-income countries are related to virus like the HBV or HPV. HBV is from hepatitis, and HPV is the papilloma virus related to cervical cancer. Other factors would be also important. Nowadays, the issue about weight. There are several cancers that are related to weight, as for instance, in women, the breast cancer, in men, prostate cancer, are related to overweight. Then we have also other factors like low intake of fruits and vegetables, lack of physical activity, and alcohol use. The problem is not just the incidence of cancer, but the diagnosis of cancer. So in low and middle countries, they have less ability to do screenings and make early treatments, because you will see that one of the best ways to counteract, to decrease the incidence of cancer is having a diagnosis, a very early diagnosis of the disease. In 2010, the burden of cancer in the world was $1.16 trillion. The most common cause of cancer death are cancers of lung, liver, colon, stomach, and breast. You have the numbers of that. You see that lung cancer still is one of the champions and is related directly to smoking. And more than 1 million people still are dying in the world because of smoking. So it is considered the main cancer factor in the world. So if you go in this map, you'll see where are the main countries that have cancer. And then you see that certain regions of China are the main countries, but very small countries you see in South America. Uruguay in South America is the main one that have a high incidence of cancer. The higher rates of cancer, I mean, the most common countries that have cancer in the world is mostly this is rates for 100,000 people, so this will not consider their population, but rates per 100,000 people. And Denmark and France and Australia are the champions there. And so you have the United States in 6th place. And then you have other countries represented. As you see, most of these countries are very well developed. and they have higher rates of cancer. But when we consider mortality, most of these countries are not in the list. You see that the mortality per 100,000 population, you don't have practically any of those countries that are first world countries, as we say. And those are countries that are developing countries. Those are the ones that are suffering the most. First, because they don't have the screening tools that we have in developed countries. And then second, they don't have appropriate treatments, surgery and chemotherapy, medication and other radiotherapy available to their population. And when they have is too expensive, they cannot treat everyone, but treat certain parts of the population with what they have. This is the statistics in the United States in 2017. You see that for male, the new cases of cancer for male, the three main ones are prostate, lung cancer, and colon and rectum. For male, for female is breast, lung, and colon. So you can say that the main cancers in the United States are prostate, breast, and colon for both male and female. So, but if you go to the estimated deaths, you see that the lung cancer is the main one across the board, either for female or male. And the second is colon and rectum cancer, and then we have breast for women, and prostate for men. So you see that the main cancers in the United States for male and female are also the main cancer that cause death among this population, essentially lung, colon or intestines, breast, and prostate. The main cause of cancer deaths, summarizing what I said there, are lung, breast, colon, and pancreas. And then for men is lung, colon, prostate, and pancreas. And I would say all of them somehow are related to smoking. Of course, lung is very clear, but the other ones, breast, pancreas, colon, prostate, also are indirectly or in a portion related to smoking. Here you have a graphic of what are the cancers that are increasing and what are the cancers that are decreasing. You see that you have a trend for some cancers that are going up, and some cancers that are being controlled. So prostate cancer looks like it's going down. Lung cancer is going down for some of the population, but you see is going down. Lung cancer is going down, very down for male, but for female is kind of flat. And the reason for that, at least in this country, is because there is increased smoking among females. And across the world, you'll see that female, as they start smoking more, the lung cancer goes up. Some of the cancers that are related to inflammation are increasing, like liver cancer, at least in males. And then you have some of the cancers like bladder and that are kind of a flat, and there is no much difference as and also uterine in women. But the good news is that there is a decrease in cancer deaths for both men and women in this country. So this graphic gives us a very clear picture of how many people have been saved because of better screening, early screenings, and treatment. So for men is more than 1 million cases, and for females is about 5 or 600,000, more than 600,000 cases of cancer that have been prevented. And that's a good news for the country, at least for the United States, not so much in the rest of the world yet. But that's why we have these types of programs to try to prevent other countries and this country to have less and less incidence and prevalence of cancer and less cancer deaths. I tried to make a drawing with this because this is very happy. So I tried to put a drawing there showing that we should laugh, we should smile for what has been reached in those years of prevention in this country. You see that my drawings are not the best ones. I apologize for that, but at least you can have a better picture of what is happening, how many people have been prevented of dying because of the prevention, screenings, and treatments in this country. So, what are the main risk reduction strategies? So first is stop smoking across the board, but then after that, control your weight, be physically active, eat less energy-dense foods like sugar and juices and sodas, eat mostly a plant-based diet. So we are from Loma Linda. We have promoted this plant-based diet for more than 150 years. So this is not new for us, but now this is from that book, and they are promoting the same traditions that we have done. Limit intake of red meat. Again, we promote vegetarianism, so this is also good news. And avoid processed meat. Processed meat like bologna and smoked meats are related to cancer of the esophagus and the stomach, and colon cancer also. And there is a trend that processed meat might be related to cancer of the pancreas. In this program, we will cover all of these cancers individually. So this is an introduction, then we go chapter by chapter, and we will see the risk factors for different cancers. And then limit alcohol. What is new about that? Alcohol kills 3 million people per year in the world. And one of the causes is cirrhosis, cancer of the liver, and cancer of the esophagus, and breast cancer in women that has a percentage of the risk related to alcohol drinking. Limit consumption of salt, mostly salted meats. And again, when they salted the meats, mostly they smoked the meats also. And fish that is salted it can have nitrates, and nitrates are related to the development of cancer of the stomach and other cancers of the digestive system. Meet nutritional needs through diet and not supplements. And then mothers should breastfeed their children. Nothing new about that, but it's important that breastfeeding should be promoted. I just have my grandchild born 1 month ago, and then my daughter is breastfeeding, and the girl is 1 month, already is turning on the bed. Breastfeeding will produce strong boys and strong girls. I have another grandson that was born 3 months ago, and this guy is strong, and he was exclusive breast-fed boy. There is also other things that can reduce cancer that are related to infectious virus. There are some viruses that can produce cancer, and this virus can be transmitted through sexual relationships. That's why this is the advice that we give for people and for the population. Sex should be within a marriage relationship, or if you want to have sex, should be protected and with one partner. And there is a high risk of transmission of mostly the human papilloma virus because of promiscuity and prostitutes and this. Avoid or protect for sexually transmitted disease. Some of these cancers, like cervical cancer, can be classified as a sexually transmitted disease. Then there should be a screening for HPV, that is the human papilloma virus, and then that they do with the pap smears. And then there is immunization when we find that there is a high-risk group of contamination. Then there is another virus called, it's not a virus, it's a bacteria, Helicobacter pylori, that is related to stomach cancer. So screening should be done by these, like the breath test, and also some people that have constantly digestive symptoms like pain or bad digestion and heartburn, they should check for Helicobacter pylori, because this is a very high risk for cancer of the stomach. Then the HBV or HCV infection, the hepatitis B and C virus, can produce cancer of the liver, and then we advise for HBV immunization if you work in a high-risk environment like a hospital or an emergency room. And limit or stop alcohol intake. We advise to stop alcohol intake. I don't understand why people still think that moderate alcohol is good when alcohol is a cancer agent, proved scientifically that can cause cancer. And essentially liver cancer is one, as I mentioned before. Esophagus cancer is another, and is related also to pancreas cancer and breast cancer in the women. Many chronic infections are related to cancer. We already mentioned about the Helicobacter pylori, then HPV, human papilloma virus, is related to cervical cancer, and then HBV, HCV related to liver cancer. HIV, the virus of AIDS, is related to cervical cancer and others. And then we have the Epstein-Barr that is related to esophagus cancer. Epstein-Barr virus, or EBV, is one that is very common in many populations and is one of the factors of esophagus cancer in determined populations. Other general advice to prevent cancer: avoid pollution as much as you can. Use masks if you work in a place that there is occupational hazard, mostly in the air. Reduce exposure to ultraviolet radiation. The sun can cause cancer in the skin, and we will talk more about that. So if you have white skin, and then you have to protect at least your head, your face, that are the places that are more common to have skin cancer. Avoid substance and activities that suppress the immune system, like drug use. Many people that use drugs will suppress the immune system, and then they will be more exposure to virus, and they will not have enough ability to kill the cancer cells, control stress, and develop a general balanced, healthy lifestyle. So that's the message for the first chapter of the Cancer Prevention Seminar. Please continue with us as we talk more about how to prevent cancer